I have with me today Pamela Field, and Pamela is a master and practitioner of Arolo Tifar. Welcome, Pamela.
Thank you, Stephen. Hello, everyone.
Can you tell us, first of all, what is Arolo Tifar?
Okay, Arolo Tifar is considered the active part of Reiki, and I'd like to justify this or clarify that. What that means is that Reiki in its essence is kind of a yin factor, a passive factor. In other words, the best way to transmit Reiki is when a person, the practitioner, is really empty and just allowing that energy to flow through without any obstacles. Right?
As a channel.
As a channel,
right.
Exactly. And Arolo is basically the yang factor of Reiki in the sense that it's just more active. You're involved in making an analysis, interpreting the analysis. The client is receiving information based on the analysis. So both the practitioner and the client are more actively involved in the healing process.
Okay.
So basically also the two originally, many thousands of years ago perhaps even, were part of the same nucleus.
Okay.
So that's why there's a relationship between yin, yang, and the active, the Arolo and the Reiki.
All right. So how long has the current form of Arolo Tifar been around?
The current form has been around since 1995. By a man named Eckhart Strom, who lived in Germany.
And how long has it been actively being taught in the U.S.?
Okay, it's been being taught basically about a year and a half now, on a steady, constant basis. There were a couple of workshops given maybe 6 years ago, but they kind of got lost on the side.
And as I understand it from our earlier conversation, you are the only Arolo Tifar master actively teaching it?
Yeah, there are 3 Arolo Tifar masters here in the United States that I know of. One of them might begin to teach, which I really hope she will, and the other 2 are Arolo Tifar masters, but they're pursuing other dreams at the moment.
Okay. So we talked a little bit about active versus passive in terms of an energy healing, what Reiki is. Can you tell us a little bit about the diagnostic part of it? How does that work?
Okay, this is really probably a very interesting part of Arolo. Arolo divides the body into 5 fields. So there would be the material, the energetic, the emotional, the mental, and even the spiritual field.
Okay.
And what it will do is indicate, depending on whether the person is dealing with just a life issue, an illness, a disorder, sleep disabilities, anything, no matter what the situation is, it will allow the practitioner to determine in which of those fields the root cause of that particular situation is located. And the idea of that, obviously, is so that it can be treated directly.
Okay.
So the theory is that oftentimes we end up treating the symptom because that's what's visible. And Arolo enables the person to find out where the root is. So it's just a quicker and perhaps more efficient, effective way of treating. Obviously, it didn't go directly to the root.
Okay. So the purpose of the diagnostic is to find the root cause. And could that be, is it always internal or external or a combination?
That's a good thing that you brought up. Arolo, basically the words Arolo Tifar mean one who has balanced the inside with the outside. So what it's always looking to do is eliminate layers of our being that interfere with who we really are in our essence. Therefore, there's 2 analyses in the Arolo Tifar protocol or in the procedure. And one will indicate which of these 5 fields of the body, previously mentioned, are malfunctioning or imbalanced due to internal factors, which could be something from the person's childhood, former relationships. It could even indicate, for example, if it's something that was handed down through a lineage, because we are filled with unhealed wounds and traumas from our ancestors, so that could be a factor indicated. And the other analysis will focus on the same 5 fields of the body and will indicate which of those 5 fields are not functioning properly due to external factors. So with that altogether, basically, the practitioner has a map indicating what's going on.
And you learn everything about Arolo Tifar in, say, one course, or are there different levels?
Okay. The first level really holds nothing major back. After the first level, a practitioner is able to perform the analysis, interpret the analysis, and also offer and give the Arolo energetic healing, which, by the way, would obviously be directed to the root cause. So at the first level, it's very complete in that respect. There are 2 attunements, 2 symbols are received. And that's the first level.
How many levels are there?
Okay, Arolo has 4 levels altogether. So the second level basically adds 4 more symbols and also enables the practitioner to test food products, vitamins, whatever, even pills, to see if it's actually adequate for the person who is taking them. So that's another added factor, which is pretty beneficial.
Interesting. So that would perhaps allow you to question, say, a dosage of something?
Yes.
Or perhaps if some food is spoiled or not spoiled?
Yeah. It's funny because even if the person, if cheese, let's say, is actually good for that person, if the product were expired and the person didn't realize it and tested it, it would say that it was not good for the person. Okay. Because the analysis would take into consideration that that particular piece of cheese is out of date.
Interesting. And what was the third level as?
Okay. Yeah, there's kind of a jump that occurs between the second and the third level. The first and second levels, the treatment is done with an imposition of the hands, as is with Reiki. On the third level, what happens is the practitioner receives 6 quartz cubes, 1 for each field of the body, and a master cube that works along the spinal column on the nervous system. So the treatment is actually done with crystals on the third and fourth level. The fourth level also adds amethyst stones. So, but I should jump back to the third level. The third level also allows long-distance treatments and also self-treatment at the third level.
Okay. So you've actually experienced giving somebody a distance healing using the roller?
Many times.
Good results?
Yeah, actually surprising. It's kind of fun because a lot of times I'll get an email from someone in, I don't know, South America or England or somewhere who does not give me much information about what they'd like to have looked at. So they give, I'm just kind of feeling sad and I would like to feel happier about my life, So that's kind of fun because doing the analysis I have absolutely no information. And usually, 95, in fact, I don't know that I've ever given an analysis where the person didn't relate to it at all. Quite the contrary. Usually they're kind of amazed. And it's not just me. Anyone can do this as a result and how detailed the information is.
Very interesting.
Yeah.
And the fourth level, what was that at?
Okay, yeah. The fourth level adds kind of some interesting factors, actually. There is an energy similar to a dialysis, an energy dialysis in the body that's given with 5 sacred names of God, actually, that come from the Kabbalah. I've researched this, and these names do exist, and each one has a certain vibration. This is used in more extreme cases, usually. There is the ability to do a type of mental programming, which works surprisingly well. I use it quite often on myself and do see results, and on other people, of course. And then at the fourth level, one receives permission. Oh, I should add one more thing. There is the possibility of injecting with the master amethyst stone medicine, basically, on a vibratory basis. So the question could be, at this level, I could ask myself or someone, do they need a physical antibiotic? Do they need the real antibiotic pill? Or would the energetic vibration of the antibiotic be enough to resolve the problem or to... So, if you can avoid, under circumstances, some certain situations, not having to take the actual pill, that's kind of a beneficial situation. The only thing it can't do would be to inject vitamins. I would also add one other kind of an interesting capacity that the Master Stone, Amethyst Stone, has, and it's not a replacement for, but a complement to chemotherapy.
Okay.
There is an application with the Amethyst Stone that enables a vibration of between 20,000 and 40,000 hertz to go into the body. Basically, it's done for 7 minutes, rest for 20, 7 minutes, rest, and 7 minutes. And what that does is really enhances, and perhaps I've seen it happen actually, reduce the amount of time that a physician thought was necessary for the full treatment. So so there's quite a few possibilities.
So are you actually working with traditional physicians and medical people at this point?
Yeah, this is actually my dream, basically, for Arolo Tifar. I am working with a physician in Los Angeles. Obviously, he gives me the name of the patient, and I check on them long distance. I'm also working with a physician here in town who sometimes has me check long distance, but other times actually will have the patient come to me to perform the analysis. And this is actually a real benefit in a way, because if you think about it, an MRI or EKG will not show if the root cause of a problem is located in the energetic field, in the mental field, as in thought forms, or in the spiritual field, or the emotional field for that matter. So my dream really is to be able to offer analyses to physicians who find themselves in a situation where either the treatment isn't working, that the patient's just not getting better, or none of the machines are indicating what's really wrong, to perhaps even, and this has happened on many occasions actually, to find another path for treatment that might allow the person to not have to undergo certain surgical procedures or take medications or pills for the rest of their life or for long periods of time.
So you would act as a referral. The physician would refer someone with the patient's permission, and you would essentially offer a consultation.
Yeah, exactly. And I would write a review, send the review back to the physician, and whether they accept this theory or not, at least to give them the patient a window of opportunity or an opening for the physician to see it from a different angle. And perhaps even decide upon the appropriate form of treatment based upon this new information.
So if this sort of thing were to become more widespread, obviously we need a lot more Arolo Tifar masters.
Well, we're working on that.
And how many do we have? But we're currently in Tucson, and this is October of 2010. First of all, how long have you started training in the U.S. here?
I've been, I think the first class I gave here was about a year and a half ago.
Okay. And roughly how many people are at each level at this point?
Okay. At this point we have 35, more or less 35 people trained in general, and I would say about 15 of those have been trained at the second level. So we're toying with the idea perhaps of bringing in, I should clarify also that the Tifar, the fourth level, allows the practitioner at that point to teach Arolo 1 and 2. So I'm allowed to teach Arolo 1 and 2. The fact that Eckhart Strom is still around makes sense, that if you can have the man who rediscovered the method teaching you, how much better than have someone who doesn't have access to all that information. So we're kind of toying with the idea of bringing, I think it will probably be Eckhart's wife, perhaps sometime in springtime. We'll see if it happens. It's just we're putting it out there to teach the first level of Tifar here. So my dream for this, once again, is that there can be, Arolo Tifar masters teaching, and that maybe one day we can really team up with a lot of physicians and offer this service, offer an alternative.
And just as an aside for our audience, I'm proud to say I was in class number 2, and I'm level 2 now. So I'm also eagerly awaiting level 3 and 4 when it comes. All right, I think we're probably running a little bit close on time. Is there anything else that you would like to? Oh, can you show us what else you're involved in, or maybe some of the training materials?
Yeah. Okay. Well, this is just one of the Atlantis Arolo 1 book. It's kind of interesting too because the symbols, at least on the first level, resemble. Wouldn't you say they kind of resemble the Shokugure of Reiki?
Similar?
Yeah, there's a similarity there. So this is the first level. I would open all the pages, but I'm sure we don't have time for that. This is a completely different aspect of my life, but I was living in Spain for about 10 years where I received my training and also gave a whole bunch of Arolo Tifar workshops. And at the same time, I was also offering workshops for women, which resulted in a book which is called The Woman Who Dreams Herself,